Hello, everyone, and thank you for taking time to join me today. Let us discuss a topic that matters a lot in nursing care coordination. We often link patients, their families, healthcare personnel, community group in our work. Because of this role, we help improve outcomes, preserve continuity, and provide good care for patients. Today's lesson we will cover the most significant aspect of coordination, including teamwork with patients and their families, addressing change within healthcare setting, ethical guidelines for choice, follow policies, and the nurse important role. We will begin by focusing on where all coordination efforts come together around patient and their family. Coordination with patient and family. Good care, good care coordination starts with people truly working together. As a result, healthcare workers must collaborate with patient and their family to create a care plan, learn about their specific needs, value, and preferences, and help them decide their health. There are several evidence-based strategies for this. Motivation interviewing helps patients talk about what they want, what concerns them, and anything standing in the way of for their help. This allows us to match care plan with what's truly important for them. When we are culturally competent, we know the knowledge, the belief, the customs, and the language that impacts care. Adjusting our strategy help us to earn trust and better engagement for the people. This approach helps confirm that patient and family understands what they must to do correctly. As a result, there is less chance for confusion, and patient will not need to be readmitted. In 2023, CARE proved that providing diabetes education adequate to culture needs help minority patient improves how they care for their diabetics. It reveals that significant impact of collaboration based on culture competency. The PCMH model is working very well within the new care model. It is type of care that emphasizes providing total connect, easy to reach, and patient focused services. With cooperation between nurses, primary care provider, and social worker, emergency visits are less likely, and people with chronic disease are more effectively cared, according to the CARE 2021. Change management. Now that we have examined ways to work with patient and family, let's examine how change management can improve the patient experience. Healthcare changes over time when new protocols are implemented, record moves to electronically system, or workers' roles are changed. Change cannot be avoided. Managing those changes properly affects the level of support our patient receive. Key aspects of change management that affects patient experience including effective communication. During care transition, patient may receive conflicts instruction to express delay where care team are not aligned. Competency in care delivery. Frequently change in provider or disruption in routine may leave patient feeling anxious or forgotten. engagement and improvement. Engagement and empowerment. Patients should be informed of change that affects them, engaging to voice concern. Karen's 8-step change module emphasized that important highlighted changes bring people together and taking action by clearing obstacles. As a result, nurses might ask bedside staff to participate in quality improvements efforts, the patient participation, and their discharge planning right at the start. Karen again 2021. By applying those principles, we ensure change improve, not disrupted patient journey. Number 4, ethical decision making in coordination. As organization change and patients have varying needs, we often encounter ethical problems in coordination care. Whether we face short resources, need to be support patient independency, or address end of life care. Ethics should guide our action. Our decision should align with the American Nurse Association and a code of ethics, which emphasizes respect for autonomy, honor the patient right to make informed decision, beneficial and non-malfeasance, promote good and avoid harm, justice, ensure fairness and equity in care delivered. For example, patient with severe heart failure decided not to return to the hospital and asks for palliative care. Because we typically suggest using more vigorously treatment method. On the other hand, we should respect what our patient wants, inform their relative, and help design plan matches their value. Karen 2023 tells us that our ethical care plan must be fair, protect dignity, and promote wellness without adding personal or institutional based instruction or restriction. Address ethic and care planning helps protect patient, encourage trust, and improve the result. Number 5, transition to policy implication. We should now examine the healthcare policy as perhaps the shape way of the coordinate. These rules in place at the federal, state, and business level can determine whether coordinate care becomes available. Keep informed and involved matters a lot for nurses. Here are some key policies that influence the care coordination. The ACA promotes the work of value-based team, accountable care organization, SCO and patient-centered medical home focus on coordinate care. The chronic care management, CCM, Morgan from the Center of Medicare and Medicaid Services offer the clinic payment for care coordination. Clinics can use the measure of cover follow-up calls, review drugs, and help people move from one care setting to another. Although it is mainly about privacy, HIPAA permits the sharing of information to ensure patient health is well maintained. Based on BAKE in 2023, using the Chronic Care Management Billing Code allows healthcare organizations to increase follow-up and medication use among older adults. When we understand the policy, we can request more tools, make paperwork more efficient, and facilitate patient access to care. Number 6, transition to the nurse role. Let us look at what we do as a nurse, as we are needed for everyone covered here. We help bring together differences, health services. We use assessment, planning, intervention, monitoring, and advocacy. Whenever we are with the patient, we are frequently one state element in their health care. Here are some responsibilities we take on as care coordinators. Perform holistic assessment that goes beyond vital signs to include social determination of health, communicating with interdisciplinary team to align goals and avoid duplications. Education patient and family. Ensure that understands their diagnosis, treatment option, and next step. Initiating referral to a community service such as mental health support, transportation, and food assistance. Documentation progress. Ensure that continued care and meeting quality standards. Care coordination is not an extra task, but it is embedded in our practice. As leaders and frontline professionals, we must continue to develop this skill to set improve patient-centered care. Number 7, community resources. Knowing what help is provided outside the hospital is a big part of care coordination. Community resources are available to meet needs, making it easy for someone who's recovered, adhere to treatment, and live well. For example, including home health services, provided skilled care at home improvements or a home environment. Public health clinic offers vaccination, screening, and chronic disease support. Mental health provider, including crisis line, therapists, and addiction recovery programs. Non-profit agencies, including Meals and Wills, transportation services, and housing program. We have observed that linking patient in our area to food parties and letting mobile clinic observe those care and differences for diabetic and high blood pressure. Nurses should study resources directions from link and community partners and learn about who qualifies for aid. We need to guide patients to those support for their complete care. In conclusion, bring it together. As we finish, consider how we use care coordination in our everyday nursing duty. Care coordination does not happen only once. It means always ensure patient receiving the best care in the best place at the best time. And with proper support, we must partner with patients and their families using scientific and cultural awareness method, oversee changes at work by communicating well and consistency, and ensure the decision maintain respect, freedom, and justice. We also need to look at the differences policies affects our work and champion need effort that improve care coordination and mobilize support from community to fix gap in patient care. We should act as a leader in organized care and leading patient-centered effort. Together, those steps will help us to develop a healthcare system that kinder, smoother, and ready to meet the needs everyone in our area. Thank you always for working toward outstanding nursing and better teamwork in patient care.